Hi everyone, I'm Dr. Alpana Mehta, a board certified dermatologist and venereologist. Today I'm here with you to discuss a very important health issue that affects at least 2 out of 3 women once in their lifetime: vaginal infections. The two most common vaginal infections are bacterial vaginosis and vulvovaginal candidiasis. First up, let's talk about bacterial vaginosis. Bacterial vaginosis is the most common vaginal infection seen in women between the ages of 15 to 44 years. It's caused by an imbalance in the normal bacteria of the vagina. Usually, this area has an acidic pH with growth of good bacteria called lactobacilli. But whenever the pH of the vagina rises, it leads to downregulation of the growth of lactobacilli and overgrowth of harmful bacteria called Gardnerella vaginalis. This change in pH can be caused by multiple factors like usage of scented hygiene products, vaginal douching, hormonal imbalances due to pregnancy, lactation, or due to usage of oral contraceptive pills, and having unprotected intercourse with multiple sexual partners. Symptoms include a thin yellowish white or grayish discharge with fishy odor. Patients might also experience vaginal burning, irritation, and redness. At times, there might be no symptoms at all. The second most common form of vaginal infections is vulvovaginal candidiasis. This is caused by a yeast or fungus called Candida albicans. Usually, this fungus is kept under control by our body's immune system. But due to factors like uncontrolled diabetes, usage of topical or oral steroids, reduction in our immunity, or due to usage of antibiotics repeatedly, there can be overgrowth of this fungus. Symptoms include intense itching, burning, and redness of the vaginal area, along with an odorless, thick, curdy white or cottage cheese-like discharge. Treatment of both of these infections involves the usage of topical and oral drugs, antibiotics for bacterial vaginosis and antifungals for vulvovaginal candidiasis. However, at times patients might not be very eager to use these drugs, and at times, in case of recurrent infection, repeated usage of these drugs can actually lead to resistance to antibiotics and antifungals. For such cases, we have a really good over-the-counter medication called Boric Acid. Boric Acid has been used for treatment of vaginal infections for over a century now. It is available over the counter in the form of vaginal suppositories or vaginal spray. Unlike conventional treatment, there is no risk of drug resistance with boric acid. In fact, research has found that adding boric acid to conventional treatment increases the treatment success rate to 90 to even 100%. It has clinically proven antibacterial, antiviral, and antifungal properties. It directly hits the microorganisms that are present within the vaginal wall and have been missed by the antibiotics and antifungals. It also helps in restoring the natural acidic pH of the vagina and promotes the growth of good lactobacilli. Using boric acid usually resolves recurrent infections between 7 to 14 days. One of the reasons why boric acid vaginal spray has become so popular compared to other forms of boric acid is its ease of application. It is convenient to apply, there is no messy application, and you can use it discreetly on the go. However, boric acid is not for everyone and should not be used unassisted. Always consult your dermatologist or OBGYN. They might assess your condition, do a bunch of tests, or maybe cultural examination to come to a proper diagnosis. Also, if you're somebody who's pregnant or breastfeeding, or if you have any open ulcers, cuts, or sores over the vaginal area, you should not use boric acid. Boric acid is only approved for people over the ages of 14 years, and remember, it should never be swallowed because it is really toxic when ingested. Although boric acid is generally very safe when applied over vaginal area, at times you might experience some burning or irritation. If the symptoms become unbearable, please consult your healthcare provider at the earliest. Boric acid is not advisable for people under the age of 12 years. Don't apply it around your eyes or mouth area. Never use it in an undiluted form, and always store it in a cool and dark place.